There are now 49,025 confirmed cases, including 2,766 deaths. To date, labs across Canada have tested over 740,000 people for COVID-19, with about 7% of these testing positive. Over 20,000 people have been tested daily, as provinces and territories continue to increase testing capacity. All jurisdictions are working towards epidemic control. However, it is critical to remember that once we are on the downside of the slope, we must absolutely remain vigilant and continue our public health measures. By achieving epidemic control, we expect that only a small proportion of the population will be immune. So, until the population has developed a high level of immunity to the virus, or we have a vaccine in place, we have to plan to live with a manageable level of COVID-19 activity. Therefore, we anticipate that some public health measures will need to remain in place to prevent the sparking and growth of future epidemic waves. The graph on the left shows the predicted number of COVID-19 cases could be in the range of 53,000 to 67,000 cases by May the 5th. The graph on the right, which is new, shows the predicted number of deaths due to COVID-19 could be in the range of 3,300 to 3,900 by May the 5th. Due to changes in the epidemiology of COVID-19 in Canada, including outbreaks in high-risk settings, the initial modelling projections on April the 9th underpredicted the number of deaths. This was because a lower general population case fatality ratio was used in the model that we had at the time. But with a large number of outbreaks occurring in long-term care homes, the actual case fatality rate was higher than the modelling scenario. The models have been adjusted with a higher case fatality rate, and we will continue to make adjustments to these forecasting models over time based on real data. Right now, we are seeing the tragic paradox of the epidemic playing out. As the epidemic comes under control and the growth of cases slows, the severe outcomes and deaths continue to accrue as COVID-19 takes a heavy toll among highly susceptible populations.
The measures we've taken so far are working. In fact, in many parts of the country, the curve has flattened, but we're not out of the woods yet. We're in the middle of the most serious public health emergency Canada has ever seen, and if we lift measures too quickly, we might lose the progress we've made. So we all need to be very careful for ourselves and especially for the most vulnerable, like our parents, grandparents, and elders in long-term care facilities. Earlier this month, when we released the first modelling, I said that the path ahead was up to us. And the same holds true today. How many new cases there are, how many losses we have to mourn, whether our hospitals can continue to cope. It's all up to all of us.
Now, Mr. Speaker, the question on everyone's mind is, how long will this last? Public health officials and experts project that the current wave of the epidemic here in Canada could last until the summer, followed by outbreaks that we will need to rapidly control over time. However, there is still so much that we don't know about the virus. What I do know for certain is that the duration and severity of COVID-19 here in Canada depends on all of us, on our individual actions, and how we rigorously follow public health directives. Containing the spread of the virus and keeping the number of deaths as low as possible will take continued, collective, and determined effort. As Dr. Tam said yesterday, the effort of getting through this will be like a marathon. We have to plan carefully and we have to pace ourselves. The decisions that we make now will determine critical outcomes across the country in the weeks and months to come.